Hello, and thank you for joining me for this ketamine patient training video. My name is Nicole Mason. I am a psychiatric PA. I've been in practice since 2005, and today we're going to go over what ketamine is as well as how to take it at home. So to start off with, over the course of this presentation, it's going to be pretty quick, but we're going to talk about what are the essentials to getting ketamine, how to prepare it, how to safely store it, how to take it, and what to do if you have a problem. So first of all, let's start off with what is ketamine. So ketamine is a medication that has been around for a really long time, and its original FDA indication was for anesthesia. So what does that mean? It means that can make you very tired or sedated. However, along the way, we've also found out that there have been a variety of clinical studies that show support for treating uh, mental health problems like depression, anxiety, OCD, and PTSD, as well as chronic pain problems. Um, Always ketamine should be administered under some kind of medical supervision. So that means not going out in the street and buying ketamine. It can also provide treatment when other medications fail, especially for your anxiety, PTSD, as well as depression and OCD problems. So, what should you do to prepare for ketamine at home? So, the first thing you need to do is consult a provider to decide if ketamine is right for you. So, for example, if you have a problem with blood pressure and it's not controlled, then ketamine isn't right for you right now. You need to have your blood pressure under control before you start a medicine like ketamine, because ketamine can transiently or for momentarily increase your blood pressure. Next, after you talk to your provider and your provider decides that you have a problem that can be helped by ketamine, you need to obtain a prescription and instructions from your provider on how to take that. The next thing you're going to need is help. So, in order to do ketamine at home, because it is a sedative medicine, you're going to need to have someone to sit with you, or a quote unquote sitter, for the duration of your ketamine treatment. Other things that are necessary for treatment besides the companion would be the medications. You need to have that at the day of your treatment, as well as a blood pressure cuff, because we have to ensure that your blood pressure is under 140 over 90 before you can start that medication. Other things that you may find that are useful when you're taking the ketamine are music. Recommendations from us are not to listen to music that have meaning or that you've really heard a lot of before, because that can help you start to associate with things in your past, and that's not what we want. We want this for to be a time where you start to form new associations and better coping skills. And so the recommendation is for you to listen to some pleasant music that you haven't heard before. Also to journal. This would be a great time to journal. Um, you're going to need some internet access for Zoom and a phone so that you can get on your appointment at the beginning and end of your treatment. You also need to know what your local emergency number is, as well as your non-emergency number in case something happens so you can get help quick. The office phone number is listed at the bottom of the slide. It's 888-688-0646. So you can always call us for a non-emergent problem. And then you're going to want to be somewhere comfortable, like a recliner, living room chair, uh, bed in your bedroom, somewhere just pretty comfortable to relax in. So, understanding the dosage, a couple of things. First of all, ketamine has many administration forms. It can be inhaled, so that means in your nose. It can also go in your buccal mucosa or just pocketed in this cheek right here. Alternatively, you can take it sublingually, which means under your tongue. Finally, you can also take it orally, or there's an oral kind of medicine as well, um, as intravenously and IM. So what does intravenously means? That means that they access a vein and push it through that vein. IM means intramuscularly, so it's like kind of like if you're getting your yearly flu shot, it's like in the shoulder or something. For ketamine at home, the kinds that you would get would be either inhaled or the buccal sublingual formulations of the medicine. Measurement. So sometimes the sublingual tablets or the troches will be scored. And so your provider might tell you take half of a pill. So make sure that you know the correct dosage before you start your treatment. Storage, important. Ketamine is a controlled substance, so you need to keep it stored in a safe place out of reach of kids or pets, preferably locked, because if you lose your medicine, we won't give you more of the medicine until it's time for your next refill. So administration methods are sublingual, under the tongue, spray, so that's the nasal spray. And you need to pay attention to your provider to figure out, how many sprays am I taking? How am I taking a full tablet, 1.5 tablets, half a tablet? You know, w- what is the measurement for this drug that I'm getting? So be sure of that before you start your ketamine appointment. So step-by-step guides. So find your comfortable place wherever it is in your home. Find a support person because again, somebody has to be with you. We will check at the beginning of the appointment to ensure that your sitter is present. And then you're going to measure the dose appropriately according to what you discussed with your provider and the medication dosage that you both decided or that your provider decided. And then you'll take your medication in the method that your prescriber prescribed. So whether that's sublingual, oral, or intranasal. And then you'll sit down and let the medication take its effect. A couple of safety precautions. So you need to avoid any heavy machinery or driving until you've had a restful night's sleep after you've taken your ketamine therapy. You also need to stay hydrated. And so when you read the slide, it says both before and after. You should probably not be eating or drinking within anything within 2 hours of your ketamine. So when it says before, I mean like a while before. But you want to make sure that you're good and hydrated both before and after taking it. And then with your sitter, you want to be aware and monitor any side effects so you can report back to your provider at the end of the treatment so that if there's anything that needs to be fixed, you guys can adjust the dosage accordingly. And then again, to have that emergency contact number. So obviously 911 is always appropriate in an emergency, but also to have your local area's non-emergency number. Um, for us, you can call us for any non-emergent problem or issue during the course of your treatment. Monitoring and aftercare. So if you're having any symptoms with your treatment, keep your journal, write it down, tell your provider at the end of that treatment session what problems or issues you may have so that you guys can work to fix it. And then make sure you make your follow-up appointment because sometimes bookings can get kind of tight. So to make sure you have your appointment scheduled at the beginning of your treatment session. At the end of your appointment, if there are any adjustments that need to be made in your treatment, you'll go over those with your provider and you guys will decide what best treatment dosage is needed going forward. Important to know some possible side effects of ketamine. So common side effects are drowsiness, dizziness, or nausea. So dizziness is kind of usually more like a whirly drunk feeling. Less common side effects are kind of an out of body or floating experience called dissociation. Serious side effects, so some serious side effects that you can have with ketamine are palpitations or what's called an increased heart rate, as well as hallucinations. So that means seeing or hearing things that aren't there, and confusion. So remember, again, ketamine is a sedating drug, so sometimes you can be kind of confused with the medicine. You can also develop something called interstitial cystitis. So when to seek help? Contact your doctor if you experience any concerning symptoms, any emergency symptoms. Remember, again, you need to seek emergent care from 911. Additional resources, you should be aware that there's lots of online support groups for those undergoing ketamine treatments. You're not alone. There's a lot of people that use ketamine to help them feel better. You can always ask your provider to direct you to more educational resource materials, as well as there's some helplines that you can keep a list of to help get more mental support help, whether that is to do talk therapy with a therapist or joining in on some of those online groups as well. If you have any questions, here's the contact information for the office. You can always ask your provider any questions during your initial appointment or any problems or issues you're having during the course of your treatment. Thanks so much for listening to this presentation, and that's the end of our ketamine patient tutorial. Thanks. Bye.